Our second speaker is Eunjung Lee, who's Associate Professor of Clinical Population and Public Health at the Kirk School of Medicine, USC. And I think she's going to continue talking about our theme of disparities. Topic is on gastric cancer among US-born and foreign-born immigrants in the US.
Okay, thank you for inviting me and thank you for the kind introduction. So let me get started. Okay. So we heard multiple times that gastric cancer is not common in the US. But it was the leading cause of cancer death in early days in the US, like in 1930s. And there was dramatic decline over time into the 1970s, and it continued to decline afterwards until the current time. So more recent instance trends in each race ethnic groups are shown here using the SEER data, which provides the population-based estimates and cancer instance trends. Here we have the most recent data from 2020 and 2021. I don't want to overinterpret the instance during the pandemic times, but as we expect, all the data points in 2020 is lower. But then in 2021, there's a little bit of uptick, like a rebound. But I think still it's too early to draw firm conclusions about trends until now. So maybe we have to wait a few more years. But at least we can see from these graphs that incidence has declined in all race ethnic groups in the US, both in men and women. And there's a dramatic disparities among all four racial ethnic minority groups: American Indian and Alaska Native, African Americans, and then Asian Pacific Islanders and Hispanic populations. And again, as we heard many times, API is a heterogeneous group with a large proportion of foreign-born immigrant populations. This is from LA County. And being in LA, the LA County Cancer Registry has reported disaggregated cancer incidence ever since its inception in 1976. So here we see a nice separation. I should say the unfortunate separation of the graphs. Korean, Japanese, and more recently Vietnamese are on top. At the bottom, we have non-Hispanic whites and Filipino and South Asians. In the middle cluster, we have African Americans, Chinese, and Latinos, and other Southeast Asians. But still, those in the middle cluster still experience about twofold higher incidence than non-Hispanic whites. So there is a really huge disparities for stomach cancer incidence. The incidence in women is lower, but it shows the same disparity pattern. So if we consider the worldwide cancer incidence, a few East Asian countries have the highest incidence, like Korea and Japan. So we wanted to compare the incidence trends in Korean Americans and Japanese Americans, now using the statewide California data available since 1988. So here we see the Korean Americans at the highest instance, and it was about 5 times higher than that in non-Hispanic whites. And it was about half of the rate in South Korea. Now, adding the data on Japanese, we see that South Korea and Japan have very similar rates, very high. But Japanese Americans, which was the ranked number 2 in California, are here. There's a big difference between Korean and Japanese Americans. And Japanese American rate is actually closer to the rate in non-Hispanic white than to the native Japanese. And the major difference between Korean Americans and Japanese Americans is that the vast majority of Korean Americans are foreign-born first-generation immigrants, but the vast majority of Japanese Americans are US-born second or third-generation immigrants. The same pattern is seen among women. So these patterns are in line with the seminal findings from Hawaii in early days. So that illustrated the changing cancer incidence patterns in Japanese migrants to Hawaii. So here, they compared to Japanese in Japan. The first generation Japanese migrants experienced much lower stomach cancer incidence, and it was even lower in the second generation Japanese migrants. But still, it was much higher than that in non-Hispanic whites in Hawaii during the same time period. So for these largely immigrant populations in California, we looked at their stomach cancer incidence separately by nativity or by country of birth. So overall, we can, the blue is men and yellow is women. The foreign-born immigrants have higher incidence than their US-born counterparts for all of these racial ethnic groups. And if we look at the difference by nativity, like foreign-born versus US-born, the larger differences are found for Japanese and Korean and Chinese. There are some blanks here. Those were suppressed because of the small numbers, but the pattern was similar as shown here. In contrast, the difference by nativity was only modest for Hispanics. So foreign-born individuals and US-born Hispanics did not have much difference in terms of gastric cancer incidence. So now here, let's focus on the difference between each of these groups versus non-Hispanic whites. So the blue line is the mark for the non-Hispanic white men. The yellow line is for non-Hispanic white women. Here we can see that actually foreign-born Japanese men and women had a very high stomach cancer incidence, just like foreign-born Koreans. And next, the foreign-born Hispanic, Chinese, and Vietnamese also had elevated incidence, about twofold than the non-Hispanic white men and women. Now, if we look at the US-born individuals, US-born immigrants, US-born Hispanic men and women still had elevated gastric cancer incidence compared to non-Hispanic whites. And also, US-born Japanese men had elevated incidence, about 1.3-fold. So 1.3-fold and 2.0-fold. So, and other US-born Asian Americans did not show elevated incidence. So the conclusions from this nativity-specific analysis is that foreign-born immigrant populations generally had much higher incidence than their US-born counterparts, but certain US-born subgroups, like Hispanic and Japanese, also had elevated incidence. So with that, now let's look at stage distribution. So what this graph shows is the percentage of localized stage stomach cancer. So this is the registered term of earlier diagnosis in California between 1988 and 2019. So here we can see the percentage of earlier stage diagnosis is higher in Korean Americans than any other race ethnicity throughout the time period. And actually, it was highest until 2015, and the gap between Korean Americans and the others were widening. Then in the last summit 2 years ago, I presented this, and then at the time, we are not sure if that decline after 2015 was just a one-time fluctuation or it will persist. Now, we have the data from 2020 and 2021, but again, it's the pandemic time, so we are not quite sure if we can trust the data. But if we just compare the percentages as is, then the percentage for Korean Americans stayed the same, like 39%, and actually it was the same as the percentage for non-Hispanic white. So the early detection rate during the pandemic time was the same for Korean and non-Hispanic whites. And then the percentage for African Americans was actually higher, 48%. So I had to repeat this, the calculation multiple times to see if this is really right. But again, this is what we see as of now. And the Hispanics continued to have the lowest early detection rate, at 31%. But it was a slight improvement from 27% in the previous time period. So whether or not the early detection rate we see is accurate, all these are much lower than the early detection rate in Japan or South Korea. So we are not doing well in the US. So now this graph shows the percentage of a localized stage by nativity. So even without looking at this graph, for any cancer site, I can imagine the early detection rate is higher for US-born immigrant populations than their foreign-born counterparts. And we see the same pattern for stomach cancer as well for Hispanics and Japanese. And we don't yet have presentable data for Chinese, Filipino, Korean, and Vietnamese Americans. But the foreign-born Korean Americans had a very high percentage of localized stage disease. But given the shared story from Dr. Kim yesterday, and also from other several other reasons that I'm going to discuss in next slides, we are concerned that the advantages or earlier detection for Korean Americans may not hold when it comes to the US-born or the next generation Korean Americans. So in this graph, I'm showing the percentage of localized stage disease only for Korean Americans in 2010 and 2014 using the SEER data. So this is the time when the early detection rate for Koreans were at its peak. So now we can see that the early detection was higher for Koreans in LA County than others in California. Than Koreans in other California and Koreans in outside of California. But if we make the same comparisons for other racial ethnic groups, we don't see this trend. The percentages were similar across the different regions or even lower in LA County. So it's not just that the LA was doing better for everyone. It's more relevant to the fact that LA has very large Korean American community and a large number of Korean American physicians who are more aware of the disparity issue and more open to the earlier use of endoscopy. So our speculation was that the earlier use of endoscopy led to earlier diagnosis in Korean Americans. And we did some surveys in the community for physicians and Korean American patients and the general population. And the results from our surveys are supportive of this notion. But all of these percentages, even in LA County rate when it was at its highest, was still much lower than the early detection rate from Korea, where they have a population-based screening program. So I'm going to skip the next 3 slides because the survival rate comparisons follows exactly as the stage distribution comparisons. So this is my last slide. It shows time trends of stomach cancer mortality by race ethnicity in California. And again, despite their earlier diagnosis, Korean Americans have very highest stomach cancer mortality due to their high incidence. And in the middle, we have a large number of racial ethnic minority groups that had about 2-fold higher mortality from stomach cancer. So to better display or properly display the still huge difference between these minority groups and non-Hispanic whites, let me end with the data from the SEER, the nationwide data, that nicely presents how much difference is there for the stomach cancer mortality. So in summary, stomach cancer is not common in the US, but there are high-risk racial ethnic groups. Foreign-born immigrant populations experience substantial disparities, and certain US-born groups also experience elevated incidence. And Korean Americans are diagnosed earlier, likely due to their earlier use of endoscopy. And when we were first starting the first summit, I really liked and excited about this argument. Then there is a precedent, like lung cancer screening, like a CT scan, for asymptomatic high-risk populations with heavy smoking history. And that was covered by insurance companies and Medicare. So we are promoting the idea that it's time to consider insurance coverage of endoscopy screening for high-risk populations. And I really enjoyed the learning from yesterday that we are developing strategies for that and further risk stratification. And also, it is also important to make efforts for primary prevention of gastric cancer to reduce risk factors. Okay. Thank you.